you have one round of chemo, one type of chemo, it may not work. Then an oncologist, because they're trained in oncology, will offer you their next most effective chemo. And then if that one doesn't work, then they'll offer you their next most effective chemo. And if that doesn't work, then they'll offer you an experimental chemo, which may not even be for that disease, but they'll give it a go anyway. And I don't think that's a very good therapeutic model, personally. I think if the first one didn't work and the second one didn't work, I definitely wouldn't be having the third one. And what happens is patients or people, humans, we forget that we offload our responsibility to the doctor because we're meant to trust doctors. They're meant to help you. But what happens is you offload that responsibility and you listen to someone, but they're just giving you their opinion. And if you don't feel like you want to take that medicine, you don't have to. You can stop halfway through a dose of chemo, say, can you take this strip out of my arm? I don't want any more. And that's your choice. And a doctor can't force you to have chemo. They do put, whether it be subconscious or conscious thing, there often is a lot of pressure associated with oncologists to take the chemo because they feel that they're doing the best thing for you. You may not feel that's the best thing for you, and you might want to use cannabis in conjunction with chemo, or you may want to not take the chemo and try nutrition and cannabis as a treatment. You know, you might think, oh, it's just not worth all the pain and side effects I'm getting from this stuff. And they said there's a 5% chance, if they tell you what the chances are, and they often don't. You know, one of my jobs is to decipher that maze for you. So when you go in and get cancer and you're going through all this stuff, it just washes over you sometimes. You don't know what they're talking about. I decipher those words for you, and I'll say, well, what do they want to give you? They want to give me doxorubicin, or they want to give me this other chemo agent. And look, I don't know them all off the top of my head. I know what they're called. I'll do a bit of doctor Googling right then and there in the consult with the patient. I say, well, look, from what I can see, you've got a, you know, if you take that as they've recommended, you've got a 5% chance of an increased survival of about 3 to 6 months or 1 to 2 years, or whatever the studies do indicate. Generally, they don't indicate a massive increase in survival. But the studies also indicate the chance of having what side effects. So you might have a 5% increased chance of living an extra 5 months, but you might have a 40% chance of having diarrhea for those 5 months and having terrible headaches and vomiting, which is very standard. So how do you broach it? Well, you just say, well, what do you think about medicinal cannabis? You know, can you help? I would like to take medicinal cannabis. You know, I feel like it'd help me. You know, can you help me with that? And if they say, look, oh, no, I don't know anything about it, or I'm not really sure, we'll say, well, can you provide me, you know, can you just provide me a referral to see plantmed or a similar group, or a doctor who is sympathetic, and provide them, give me my information, my health summary, so I can take that to this doctor and he'll take care of it and get access to this medicine for me. And look, all the doctors should say, look, no worries, that's your right, this is your information, here you go, here's your letter. You know, I'm sorry we couldn't help you more. Hopefully you're going to get better help over there. It doesn't always turn out that way, but remember, it's your right. And if that doctor is just offensive or is not helping you or is negatively helping you, you don't have to talk to them anymore. You can choose another doctor, you know.
So you're asking for the health summary. That's the paperwork.
The paperwork would be a referral letter.
Yep.
And if you can get a health summary, that just helps my doctors or myself see your history, see what's going on with you, see what operations you've had. I mean, you can tell us as well, that's the history taking, but it's always good to have that, and particularly for the paperwork, it's nice to have that health summary and a referral. They're not imperative, but they are very helpful in getting things through. Yes?
Being cannabis a whole food and treating certain symptoms, where are your thoughts in relation to the cost? Do you see this as a crutch and for a temporary usage to elevate a particular cause or a particular symptom that is caused by either unhealthy diet or chronic dehydration or being in an environment that is not supporting your system?
Yeah.
Where is your take on that?
So the question is, you know, is cannabis going to be a crutch? Am I going to be leaning on this? Do I need it long term? Is that the question?
That is the question. And in
Oh, right. Oh, yeah, go get it. And how does cannabis work in relation to treating the cause of the disease? Yeah.
And do you talk in your practice about, looking at the cause and say, hang on, this symptom is derived from X?
Oh, yeah. No, I understand, yeah. So,
temporary solution to resolve immediate.
yeah. So, in terms of the legal pathway, we can only... The studies that are available only show relief of symptoms. They don't say, okay, you can cure cancer or you can cure anything. They do show that if you take cannabis, you have reduced symptoms such as reduced pain or reduced nausea or whatever it is. So that's the approval, but that doesn't really mean anything to me. What's important is the cause, exactly why. I always think, and I always train my doctors to look at each patient, go, why is this person sick? Not just, here's an endone because you're in pain, but why are you sick? If the reason for your pain is a physical thing, such as a severely prolapsed and stenosed back, where the nerves are literally being crushed every time you turn left, well, that pain stimulus is going to be there. Cannabis will help reduce the amount of pain you feel, but it's not going to fix that problem. It may reduce the swelling around that nerve so you have less pain and reduce the amount of pain you feel, but it's not going to fix the problem. That's not true for everything, and in fact a lot of the time we do have amazing cure of disease. And when you support your body through nutrition, and we've got enough health and nutrition in our body to make as many endocannabinoids as we can, they're all flying around our body and being produced on demand, in fact, in the areas where there's lots of cannabis receptors. And that's the area of your need. Okay, so if that was anxiety, it would be receptors in your brain, for instance, or epilepsy receptors in your brain generally. So supporting yourself with cannabis medicine isn't a crutch. It's, I think, it's a medicine. And if you stop taking the medicine, symptoms will return. But if you've changed the base cause of things, they probably won't go all the way back. And theoretically, if you can boost your body's levels of endocannabinoids and its health to 100%, then you don't need cannabis. You might like cannabis, but you don't need cannabis for health. A lot of people can't, a bit too damaged maybe, and not going to get that 100% function back. So in that sense, it's not a crutch, but it's a medicine. It's something that you're taking to support your body to maintain its normal level of functioning, which has deteriorated over time. So everyone's got their own set level. You, a young man, very healthy, very fit, good chance that you can get excellent health back and might just smoke cannabis because you enjoy it or because you want to maximize your health. Take CBD as a vitamin supplement, for instance, and I do think CBD will eventually go that way. Yeah, so I hope that answers your question. So yeah, it's a bit of both. Yes. Any other questions at anyone?
We're nearly out of questions.
Out of questions, all right.
Nearly.
Nelly, one more.
He said, no, you sit down. You're good, man. We appreciate you, mate.
Yeah, so, I hope that's helped everyone, and